Building health partnerships is about how local authority and clinical commissioning groups can work better with the voluntary sector. And the message that went out was, if you see a young person, we would like to see you and talk about mental health.
I got involved in building health partnerships through my school. The steering group were looking for young people. Over the course of the programme, there were roughly 14 young people involved throughout, and we were consulted on all aspects of the work. I saw building health partnerships as a collaboration to improve what we experienced in Bolton as young people going through mental health services. This is what we think is wrong and this is what we think you should do.
We knew that we had a high suicide rate, and we'd had a couple of recent unfortunate young suicides in Bolton, which had received a lot of press coverage.
It does hit home, it affects that whole community, and it's really felt, and it's really important to make sure that we take steps to prevent that, because if people see that as being normal or happening a lot, then it can lead to other problems.
Mental health is a national priority and a local priority. In Bolton, we've got over 15,000 young people who will be suffering from a mental health condition, although it be a low level, but they wouldn't be suitable for a specialist referral. So where do they go? There is a gap. There is no service currently for them. So making sure that people can look after themselves, know where support is available, access their GP for any information or support that they may need. If we can get them early in that low-level intervention, then we will prevent those mental health crises. Budgets are being cut left, right and centre, not only in the NHS, but local authority. We cannot achieve any cost reductions in isolation. We need to be looking at other services to see what they can do and how people can help themselves. So it's not all about reducing costs, it's improving well-being and preventing crisis, and by doing so, we will be reducing costs. And we need to work more collaboratively with voluntary sector and with patients and carers themselves to actually achieve that aim. Prior to building health partnerships, we didn't have any co-production around CAM's work. So one of the key tasks has been, what can you do collaboratively? What can you do together? Is there anybody that's actually duplicating what other people are doing? Some people didn't even know about other organisations in the room. One of the exciting things for me from the whole process has been the genuine co-production of the CAMS transformation plan, whereby we've got everybody together to say, these are the gaps, this is how we, and by we mean voluntary sector providers, everybody can fill those gaps. And now we're moving towards delivering that vision.
To get everyone together, to talk to each other, to see what was going on and what each other was doing was really, really beneficial.
Everybody's been involved in either the gap analysis, the pathway development, the action planning, and as a result, we've actually got a purely co-produced CAMS transformation plan, which is available on the CCG website.
One of the things that the CCG wanted to come out with was a mobile app, a wellbeing app for people in Bolton to be accessed by young people. So we looked at having information about specific mental health issues, using the language and terminology from MindEd, helping people to learn the language so that when they do go to see the GP or whoever they need to see, they'll be able to be speaking from the same page. Part of the app will also be a crisis button. So when you do need help, you'll be able to press the button. You may be asked a bit about what's going on for you, so you've got more appropriate, tailored responses, but then you'll be able to find details of the nearest place for you to get the help that you need.
We went in with future in mind, national documents, a directory and a mobile application, and we came away with much more.
We were able to offer insights into how we communicate and how we take in information and where it comes from for us. There was a lot of talk of sort of posters in schools and not being paid attention to, so we suggested other ways, like through the internet, online, Twitter and Facebook and things like that.
So our hopes for the future are that the Building Health Partnerships stakeholders will deliver the CAMS transformation plan. So the work we do still meet on a regular basis as a steering group, and we also got identified leads on all the different projects. The facilitation was really key. IVAR came with a number of different techniques to get people to actually focus on specific projects, some of which I have used subsequently for other projects. If there was any points of conflict with historic relationship management, etc., to have somebody completely external has been really useful in actually sorting out some of those and sharing examples from across the country as well. People now contact me and others from the steering group with non-mental health related issues to say, how can we work together on different projects? We've been working with the Strategic Clinical Network on a BME mental health and suicide prevention workshop. We've held 2 in Bolton. It's going to be rolled out across Greater Manchester into Bury and Oldham. We've had 3 people from the suicide helpline, which is called Hopeline, and we've had 13 people sign up to suicide prevention awareness training assist run by Papyrus, which is a national charity. The public health team has also been working with the Bolton Council and Moss to develop a 5 ways to wellbeing package, which is going to be rolled out to the madrasas, which are the schools attached to the mosques, and there's over 8,000 children in those schools.
I've become involved with now roughly 5 different projects. I've founded a support group who work with the LGBT community in Bolton, which is massively underrepresented. We work closely with Bolton Pride and other organisations in the town. We can really shape what's going on and how other people experience mental health services. Let's use this opportunity to make sure that what's being done is the right thing